I'm Felicia Seibert, a CDC contractor with ICF, and I'll be serving as your moderator. Now it's my pleasure to introduce our presenter, Mari Ryan. Mari Ryan is the CEO and founder of Advancing Wellness, which helps organizations develop a culture of well-being in the workplace. She's also the founder and former board chair of the Worksite Wellness Council of Massachusetts and is a member of the board of directors of Health Promotion Advocates and Global Women for Wellbeing. Today, Mari will describe how technology and social media can be used by companies to support their workplace health programs, and will also discuss limitations of social media and trends in the field. Thank you for presenting today. Let's get started. Mari, you may begin.
Thanks so much, Felicia. My pleasure to be here today, and I'm very excited to share some information with you that hopefully you all will be able to use with the folks that you're working with in your respective constituents. So today we're going to talk about technology and how we utilize technology and social media to support our workplace health programs. So we're going to talk about 4 different types of technologies: health portals, wearable devices, applications, and social media. And let's just start with the idea that, as we all know, technology is everywhere. We can't avoid it. Our offices, technology is ubiquitous in our workplaces, in our offices, and in our lives. We've really come to a point now where technology is in every aspect of our lives. We can turn on the heat before we leave the office. We have technology that we're wearing, and there's a whole generation that is growing up who can't figure out why someone would possibly want to talk into a phone with a cord attached to a box that's connected on the wall. So there's a lot of different elements the way technology is pervasive in our lives. And therefore, it's hard to avoid the fact that it's going to be something that we need to leverage and utilize to the best of our abilities in our well-being and wellness programs. When we talk about technology being everywhere, I think it's important to just draw on some research that supports this concept. And you'll see here some research from the Pew Research Center that shows the trend of the adoption of technology and usage over the last, more than a decade and a half. And you'll see the extent to which this really has continued to grow. And understanding these technology trends can really be helpful when you're planning to incorporate technology into a wellness program. Oftentimes when I'm working with a client and we have an opportunity to gather data, such as a needs and interest survey, or some element of a program where we can ask questions of the workforce, we often ask about what technology they use, how they use it. Do they have smartphones? And what type of phone do they have? Is it a smartphone? Do they have access to computers at home? Are they connected to the internet? And that's very helpful information for us to be able to use when we're planning our programs. We also know that health and wellness technology continues to emerge. This is a huge field that it continues to grow. And this is sometimes referred to as mHealth, which is really referring to the use of mobile and wireless devices to improve health outcomes, healthcare services, and health research, and continuing to see a number of different applications that are emerging that are focused on a variety of types of behavior change. But this is a huge growing industry. You can see the reference here that talks about $449 billion by 2020 and over 40,000 health and wellness apps for Android and iOS devices. So this is not anything that's going to go away, and we're going to continue to see the ways in which some of these technologies will emerge and change over the coming years. But when we talk about technology and the use of technology in wellness programs, there's one really, really important message, and that is technology is a tool. It is not the wellness program. I often have conversations with folks who say, gee, I want to buy X. Fill in the blank. What's the technology they want to buy? thinking that it is going to be their wellness program. It is really a tool to help them in their wellness program. And the ways in which we like to think about this are the 4 elements that are highlighted here. And this is that the technology can be used for communications, encouragement, tracking, and more importantly for community, to create community amongst the participants in the program. So really, really important point to remember. It is a tool, but it is not the wellness program. The types of technologies we're going to explore in a little bit more detail today are health portals, wearable devices, health apps, and social media. So let's start with health portals. So health portals are something that has emerged, I would say, probably pretty much over the last 5 or so years. Health portals have really become pretty standard in a lot of programs. The health portals, what's interesting about health portals is they're kind of the Swiss Army knife of technology tools for well-being programs because they offer a variety of tools and resources. They're typically available to run on laptops, desktops, tablets, mobile devices, and some of the features you can see here, and you may have access to one of these types of portals in your own business, in your own usage through maybe your health plan. So some of the types of things you'll typically see, tracking tools such as exercise, food, water, weight, planning tools such as an exercise planner or a meal planner. They often incorporate a health assessment, health risk assessment as we sometimes call it, personal health assessment, some sort of questionnaire that will assess underlying health risks and health behaviors. There's often educational aspects such as workshops. And in some cases, you may also find that there is a link to health coaching services if that service is available. And what's nice about that linkage is if someone is using health coaching services, the health coach can have access to their data, they can communicate with their coach through the portal, and there's a connection that they can then have for purposes of perhaps nudging or for the coach to really be able to potentially hold that individual accountable to the goals that they may have set. One of the things that's really helpful about health portals, and if any of you have ever managed a wellness program where you've tracked things on spreadsheets or paper tracking, that the elements of administrative and management features is probably one of the really strong elements of a health portal and what attracts many wellness program managers to want to incorporate them. So, for example, an inherent part of managing their well-being program may be around challenges or incentive management. Oftentimes, incentive management may have multiple criteria or elements that folks are using to earn points or rewards. Event registration can be helpful from a perspective of whether they're doing on-site workshops or enrolling individuals in challenges or other kinds of activities. So the reporting and administrative features that come from that can be really, really helpful to make managing especially a large wellness program, really much more manageable. And then email communications is another feature that I consider to be really important as part of a health portal, because what this really gives you the ability to do is to communicate directly with the individuals that are participating or a particular target audience. Sometimes there's mechanisms by which you can, based on risk factors, send targeted messaging to individuals. So these can be really helpful tools to be able to manage and administer the program. The question often becomes how to use these health portals and how to integrate them. Sometimes the health portals come from health plans, and they only offer the access to the health portal to members, subscribers of the plan. And one of the things we see is really important is to be able to make sure that all employees have access to the health portal. This can also be an important element if you're trying to build a culture of well-being where you want part-timers to really feel engaged with the workforce. So really making sure that all employees have access. For those programs that may be a little bit more mature, that are offering programming and services to family members, these can also be another way to really make that connection for the whole family that's participating in a program and actually have that connection be stronger for the members and the employees so that their family members can actually be benefiting as well. Again, you want to think about using these from an administration, registration, tracking perspectives so that you've got all of your data in one place. And this is where things like incorporating event registration, challenge enrollment, and management will have all of the information in one place. Incentive communications, again, depending on how your incentive program is set up, making sure that employees know where they stand when something that they have accomplished is credited to them for use in the incentive program. So it really can be very helpful to manage all of the communications around incentive management and tracking. So where do these come from? Where can these health portals be acquired? Well, oftentimes a health plan. Many health plans now offer these to all of their employer groups. In some cases, health plans may offer them to just larger employer groups or for those who are willing to pay for them. I think there's no one-size-fits-all on this. It really varies depending on the health plan and the type of services that are included. Some health plans may offer this as an add-on benefit to an employer group, but they may not have challenges that are part of it. They just it may be something that's just connected to a member as a member service for individual members and not connected back to the employer program. So there's a variety of different options that might be available. Some benefit brokers offer these health portals as well, so worth checking to see if a benefit broker has resources such as this. And then finally, of course, an employer could purchase these type of service from a wellness service provider. And there's certainly many of those in the marketplace. I'd like to give you a couple of examples of how health portals have been incorporated. And the examples, all of the employers that I'll use as examples in our program today are from a program in Massachusetts that has been led by the Massachusetts Department of Public Health for the last 2.5 years, and this is called Working on Wellness. And some of these employers all of these employers whose examples I'm using are participants in this Working on Wellness program. So our first example here is a municipality. So this was the town of Fairhaven, which is a municipality located on the south coast of Massachusetts. And they employ close to 500 employees in a variety of typical municipal departments. They acquired their health portal from their health plan. And it is a pretty standard, it's not like highly customized type of portal. It's called a Healthy Me, and it was made available to all town employees, not just those who subscribed, who were subscribers on the health plan. And the way the town is using the Healthy Me portal is to track a walking challenge, and they use it as a source for health education content, and there's also a variety of tools and resources that they have available through the portal. Employees say that they're getting a lot of information from the site, and it makes them feel like they're getting some extra benefit from their health plan. Fairhaven happens to be self-insured on their health plan, so it's a nice way to make the employees feel like they're getting some extra benefit. The second example is from a YMCA. This is the YMCA, the South Shore YMCA. They employ over 1,000 full-time and part-time employees, and they worked with their health plan to offer employees the portal so that it was available to all employees, even those who are part-time. Any of you who are familiar with the way Ys are set up, there's the majority of their employees sometimes can actually be part-time employees. So they're using it as a source for health education content and additional tools and resources. And additionally, it's using the portal's email tool to provide employees with information on healthy living resources and recommendations. So just a couple of examples there of how these health portals are being incorporated into their worksite wellness initiatives. So let's talk a little bit about some of the pros and cons of using health portals. So first off, from the pros perspective, health portals really make program administration much easier. And again, as I mentioned, if you've ever managed a program, tracked things on spreadsheets and tried to manage that way, it can be really hard. There are a lot of resources available in one place. They vary based on the portal that is selected, but they have a lot of different types of information available. And it's available on multiple devices. So I might be able to have it on my desktop, on my computer at work. I can have it on my mobile phone. So I have access to it in a number of different ways. And I think the communication piece is a really strong element of what health portals can do. It gives you a way to be connected to the workforce and specifically around their health and their health behaviors. Some of the cons of the health portals is that it really is the responsibility and ownership of the individual to use this. And the challenge becomes, if they aren't intrinsically motivated, they may need nudging. They may not go in and log in, or unless they're in some sort of an active program such as a challenge, they may not log in. We often see very high spikes in enrollment rates, but then big drop-off in usage in these types of devices. So you need to keep driving the employees to the portal to keep them engaged. So this is, again, where the communication aspect of it can be really helpful. And the one place that you may have challenges around this, depending on the skills, language, culture of your workforce, individuals with limited technology skills may need some additional support and training to help them in using this type of tool. So let's go on to our wearable devices. So raise your hand. Who's got a wearable device on? Probably many of us do. And these are, again, devices that we're pretty much seeing to be ubiquitous these days. So the basic devices that we see, and these, again, there's a whole range. There's a vast number of options in terms of wearable devices. Basic devices typically are used for step tracking, activity time tracking. Some of them now do sleep tracking, and some of them will have links to applications with additional features such as food tracking or water tracking. So for many of them, there's, really, these are the kinds of things you're going to see as the kind of get-in-the-gate types of things. They've really moved beyond just the tracking steps or tracking activity as the original accelerometers did. In some of the more advanced devices, you'll also find heart rate monitoring and also the ability to set reminders, messages, nudges. You can get your cell phone to ring through to it. There's all kinds of let you know when your cell phone's ringing, or, it's your time to go to your next meeting. So there's a lot of additional functionality that's available in some of these devices now. In terms of the integration of these devices into programs, one of the key decisions an employer has to make is who's going to own the device. In many cases, they adopt a policy of, what's called bring your own device, where employees bring their own devices, and in other cases, the employers are providing them. It can be expensive if they're using a high-end device that includes all of the features that I mentioned, in the previous comments. But it's something that, if it's consistent across the organization, it can be a bonding element between the workforce because everyone's got one. They can also be integrated with the health portal. Many health portals now on their mobile device support on their applications, they actually allow you to connect your device right into the health portal. So it cuts down on the amount of tracking that you need to do. It can also be, you can also use a third-party application or integration tool that allows multiple devices or multiple manufacturers, so that if you are adopting an employee bring your own device type of strategy, that they can be integrated together and be able to have the results available. And again, where did these devices come from? So health plans periodically may have provide access to these. I think we've pretty much moved beyond the pedometer days from many health plans. Benefit brokers may also offer these. In some cases, we're seeing employers purchasing them directly from manufacturers. We do encourage you to look for discounts and really encourage you to look for less expensive devices that are, not brand names or even refurbished models. I had a client that we were working with, the Massachusetts Workers' Compensation Insurance Company, that we were working with and working with some of their policyholders. And one of their policyholders had a very creative IT guy, and he said, I bet we can find something out there that's really inexpensive. And he actually did. He was able to find a device, a wearable device that was fairly reliable, that was about $12 per employee. And they were able to create a great program based on that. So it takes a little creativity, but it's not to say that they're not out there. Let me just talk about another example here. This is from an organization, again, in Massachusetts. This is a not-for-profit, a small not-for-profit organization that's a social service agency providing services to individuals with disabilities and employing just 40 employees. They purchased Fitbits for use in a walking campaign. And what they did was they asked each participant to sign a waiver. They had 94% of their employees participate. And they, in essence, gave the, in this case, Fitbits to their workforce and encouraged them to set their goals based on their tracker features. So it was increasing steps or increasing activity time. And if they completed the program, then they got to keep the Fitbit. So this was a nice way for a small organization to really bring their team together around a common challenge and a way to really connect. So this was really fun for them. Let's look at the pros and cons here. So for wearable devices, again, you've got ease of administration of the program. And in some cases, it actually takes the ease of entering things off. There's no burden for entering things on the employee either. They're not writing things down on a piece of paper or having to log in. It's doing all the work for them. If employees, if you use a BYOD approach, then the employees are paying for the device. It doesn't hit your budget. And they are much more reliable than how many of us have lived through the days of pedometers when, I've probably had a closet full of pedometers at various points in time. You all did too, but they were not as reliable as we would need them to be to really be able to use them in a meaningful way. But we got by with them for years before there was another option. In terms of cons, the biggest one that I am most concerned about in using these types of technologies is that the research really shows that interest in this wanes after about 6 months. So while everybody's all hyped up and excited about it at the beginning, then sometimes, it's not going to last. And this is where, the extent to which folks are intrinsically motivated to do this as opposed to just being extrinsically motivated to, win the challenge or be on the winning team. We really want to hope we can encourage long-term use for individuals. There's always the challenge of lost devices. The first wearable device I had was very prone to the device, the band on the device popping off until somebody showed me that, oh, you buy this little belt that goes around the band so that it doesn't pop off. And that prevented me from losing my second one. But you need to make sure that you're aware of the issues associated with lost devices. I think they may tend to attract the already healthy population, not the people who may benefit most from these new health behaviors that you may be trying to encourage. So this is another piece to think about. It's not to say that it's not going to encourage individuals to start to adopt a new behavior, but we just want to be careful that we're not, just having the same individuals who are already healthy engaged, and that the target population that you might want to be reaching not engaged. So just keep that in mind. So let's go on to apps. So as we know, there's an app for everything, or at least it seems like there is. With regard to behavior change and health, this is a whole universe that is just so enormous and emerging in so many ways. Many of the specific behaviors that you may have seen or used apps for are things like tobacco cessation, food tracking, weight management, stress, sleep, mindfulness, personal health information and family history, and biometric tracking. So there's any number of possible options here. I've been testing apps for a variety of clients, and it's fun to see some of the different options that are available. And one day last week, we had 4 different apps that I was scheduling into my day to make sure that I could test each one of them. So it's really fun to see how different apps are being developed. We often see chronic condition management as another place where apps can be very specifically useful. Blood pressure tracking, diabetes tracking, medication tracking, and pain management. And this is a place that health plans and in some cases providers are also starting to take more initiative and work more closely in case management and managing some of these chronic conditions. In terms of how these are integrated, you need to develop a specific intervention that utilizes an app, but typically only as one aspect of the intervention. So let me use an example here of tobacco cessation. So there are a number of quitting tobacco apps that are available. But we know that that could be just one mechanism by which to be able to attract individuals to this type of program and give them resources to be able to participate. Group discussions and the kinds of programs such as the gold standard for freedom from smoking and those kinds of things that were based on evidence-based programs that showed group interaction and group support were important elements of being able to quit tobacco. And then utilizing tobacco cessation aids such as nicotine replacement patches. So these elements offer different approaches. So there's awareness and education, there's behavior changes, there can be nudges. They offer the support element, and together these types of approaches can be integrated to offer to your workforce or to the workforce to be able to help them around, in particular, a behavior change approach. But the app alone is probably not going to be sufficient to be able to accomplish your objectives. And where to get these? Well, they are everywhere, and they're easy to find pretty much on the Internet, and they're available, for these the 2 main types of devices, Android and iOS type devices, the operating systems. But it takes some research to really be able to know what is going to be right, what is going to work, what is, has something got some, good scientific evidence behind its use. I could go and create an app next week, but is it going to have any real application and evidence that's going to support that it's going to accomplish what you want to set out to do? Let me use an example here of an organization that is a little bit larger organization. This BAMC stands for Brockton Area Multi-Services Incorporated. This is a social service agency providing services to individuals with disabilities and employing over 2,000 employees. They implemented a walking challenge that employees could participate in on their own time. And the time is tracked through a step tracking device of the individual's choice. But then it's posted on a leaderboard through an application that's used on a smart device. And if you're not familiar with leaderboards, really what it is it's just telling us who's ahead. And the motivation here on the individual employee is that, to be part of a team, or whether, they're in some cases participating as individuals, not as part of a team. They want to enter their information, and people want to see who's ahead. So utilizing an application of this nature, it offers a couple of benefits. First, it provides a way to communicate easily to the participants. It encourages the competition aspect using aspects of gamification, but it also can encourage social connection between employees. So this can really be a neat way to be able to think about how to incorporate an app into a campaign or into your wellness initiative. So let's explore the pros and cons here. So these, again, offer easy administration of the program. They can actively engage employees. It can create a sense of belonging and connection and camaraderie. And all of those pieces, the belonging, connection, camaraderie, these are core to intrinsic motivation, which is really one of the things that we're trying to achieve, and provides visible, measurable feedback to participants. So being able to really see where things stand and how everybody is doing is really going to create some buzz. But some of the cons on this is there are a ton of apps to choose from, and they're not all created equal. So really being able to understand what we call, have a requirements definition that you're using when you're selecting an app and know what you want it to accomplish, how you want it to be, how do you want to use it. So really being able to think that through. Some apps are free, some cost. You really have to weigh that in terms of how that fits with your budget. And if using multiple apps, another step may be required to aggregate the data. So think about how everything is going to interconnect and how that data is going to be managed. And then keep in mind how you need to keep people engaged. So do you need to remind them to be using this, or is it something that, if things are going well and they're intrinsically motivated to use this, then you're not going to need to nudge people. But sometimes, it's not a habit. It's not part of their day, so they don't think about on a regular basis the logging or whatever it may be. So some considerations to think about how the app interacts with the individual and how often they're going to be nudged or encouraged to use it. Well, let's head into our last section of our conversation today on social media. This one is an area that is, just everybody seems to be talking about this. So let's jump in here. So one of the elements around some of the features of social media in particular are the aspects about engaging participants. Something that's easily accessible, always available. You can make it a game. You can use it as a recognition mechanism. And most importantly, you can get the participants to become the content contributors. I think that's an element that, the idea of it being social is, after all, about not just, it's about a conversation. It's not about just, one person, putting information out there, which is often where we start. But the idea is we want to start to make this truly social. And in terms of a definition of this, just so we're clear about what we mean by this, this is both websites and applications that enable users to create and share content or to participate in social networking. When we think about social networking in the context of health behavior, this is actually a fascinating, to me, I find it just as a fascinating field. We as human beings we're genetically predisposed to connect socially with one another. Long before there was technology to make social networking easy and available, we had families and tribes and villages where our social network existed. And socializing, it turns out, can be good for our health. And I love the fact that research is being done in this area now. Social scientists Nicholas Christakis and James Fowler have done some work in this area in their epidemiology studies that good behaviors like quitting smoking or staying slender or being happy can actually pass from friend to friend, almost as if they were contagious viruses. So I just love that idea that good behavior and good health habits can actually be shared. And we see this, that we can influence one another's health just by socializing. So good health, and therefore good health behaviors, is actually a product of the sheer proximity to other healthy people. And the problem is that it also applies to bad behaviors. So we can infect our friends with obesity, unhappiness, smoking, and this is what's called the social contagion theory. So the workplace, in and of itself, by its very nature, is a social network. It's a place where people they come together with a common purpose. And it is an ideal environment in which to leverage these peer-to-peer interactions for the purpose of encouraging healthy behaviors. So we've got the container in which to be able to really encourage this. So fascinating research that I really enjoy learning about some of these things and how it impacts health behavior. So when we think about how to incorporate some aspects of social networking into wellness programs, the key is that we want to be able to find ways to create connections. So it's about these connections, with individuals. And this is what challenges and competitions do for us. And when we can do that in a way where, individuals, so the peer-to-peer invitations and interactions are starting, then it's really something that starts to take on a life of its own. People get talking about it. One of the things I think is most powerful in the elements of social media is the use of stories and how stories can inspire other individuals and make us want to be like that person. I have a person who's been on my team for a couple of years who is a master at this. She has coached marathon teams and she runs marathons herself, and she's just inspirational in seeing what she does. She logs when she comes back from a long run, or just last week she finished a marathon in Maine, and the stories she had that went with that. It's inspiring and hopefully contagious. Leaderboards can be a way to use social media to be able to keep folks posted. Again, you want the participants to be generating the content and generating those stories, and you want them linking together for these social behaviors. And in some cases, linking incentives to social behavior can be another approach. I'm not a big advocate of incentives, but in some cases, you may be able to use incentives to drive folks to some of this. In terms of how to integrate, really need to set up specific sites for the use of as a part of the program. Again, it's not the whole program. It is a part that's going to support the program. We often see Facebook used as a part of a workplace health program, inviting participants to post their pictures, of them doing, them and their families doing healthy activities. And this is where you start to get that conversation going amongst the individuals. So really want to encourage that it's not you just posting things out there, although that's a great way to start. You want folks actually taking an active role in it. So the important thing in thinking about which social media tools to use is, because there's a lot of them, is ask employees what they're using. Are they even using social media tools? You may find that they, have some folks who use Instagram, but they only use Instagram for, their personal life or their family things. Some people use LinkedIn just for professional, but don't use and only use Facebook for personal things. So you really need to understand, what are people using, and then, where do they really want to, how do they want to be interacting? So you really want to research, which is right for the given program that you're doing and that your workforce is going to be doing, and making sure that you're encouraging, your employers to be able to think about what's the right program, what's the right social media mechanism for them to use. Let me talk about a couple of examples here in terms of some of the folks from the Working on Wellness program. Gandhara Center is a mental health services provider that employs over 700 employees. They're using technology as a tool for a physical activity awareness and education initiative. And what they did was they developed a Facebook group for their employees, and they use an easy text. They use it as a way to text and send messages to employees as a way to increase physical activity. And then employees who sign up receive monthly emails, they receive weekly Facebook posts, and biweekly texts. So you can use it as a communication mechanism as well. But again, the key to this is it can't just be outbound to the employees. You want to really encourage their engagement and interaction. That's when the social element really comes into play. And this organization is a Head Start organization called Pace Head Start. They're, again, a small non-for-profit organization with a small budget. They only employ 77 people. And they're using a private Facebook group to create community with and to engage their workforce. They have a member of their wellness committee who posts twice a day on the page, and they sometimes include healthy links to nutrition articles, local events. They're also using Fitbits as a way to encourage increased physical activity. And the staff was offered an opportunity to get up to $100 reimbursed for the purchase of their Fitbits. 65% of their staff was engaged, and they were using their Fitbit app to connect to to both this and the community. And they've now on their own initiated walking groups as a result of this initiative. So really finds a way to start to connect the individuals. So I just want to go through the pros and cons on this. Again, participants, you want to get participants getting the information. This may attract a younger element of your workforce. Think about this in terms of the demographics of your workforce. Are the members of your workforce even using these types of social media tools? Provide alternative communication channels, because it can use this as a way of getting information to folks where they may already be, and it can create a sense of community and be fun. And then the cons of this are that if you are looking at content creation or maintenance tasks, those can take time. So you want this to be social. You want the participants to be generating the content so that it doesn't have to be something else that the champion or the wellness committee is doing. And then we always have that distraction during the workday that employers are concerned about.
Thank you, Mari. Well, this concludes today's webinar. So on behalf of CDC's Workplace Health Resource Center, thanks for making wellness your business, and have a nice afternoon.